Hi everyone. My name is Dr. Adnan Ahmed, and I am a psychiatrist. I'm working in UK. Um, I'd like to thank everyone for joining this presentation. This presentation I arranged specially as a live interaction with some specialists who are working in UK. So this is the first of the series, and the first one I'd like to introduce Dr. Abrar, who is a ST3 in Peds working in Manchester. He's originally from Pakistan and he graduated in 2012. And he has got experience of working in Ireland as well in Peds, and then also he came to UK and he's also done his exams which are associated with Peds. So he has a very good heart as well. I know has been helping a lot of IMGs, a lot of doctors who are looking into coming to UK or even Ireland as well to understand what are the career pathways and how can we involve ourselves or how can we improve ourselves to actually gain those competencies and gain the training. Uh, then we also have Dr. Moledina. Sanaa is one of the psychiatry doctors who is a junior doctor who is interested in psychiatry, and she will be helping to run this event, and she will be reading your questions from the comment sections, and then we will be asking that live from Dr. Abrar. So, Dr. Abrar, thank you very much for joining and doing this for us. I know you have got a small presentation you like to do first, and then we will go on the questions.
Yeah, thank you very much for having me here, sir. We'll start with my. This is just the introduction to pediatrics. This presentation is just to introduce like how pediatrics is and just to put as a baseline. So I've kept it short purposely so that we can interact more, take more questions. First of all, why people would want to do pediatrics or why I wanted to do pediatrics. There are few reasons which I put up here, but this is not an exhaustive list. There are a lot more reasons. People can have their own reasons to join pediatrics. First of all is this is one of the specialty you still can be a generalist in. These days, every specialty is going into a lot of subspecialties and super specialties, and there are less and less general clinicians these days. So pediatrics is still one of those specialties. You can be a generalist in pediatrics, like general pediatrician. And then you can further subspecialize into pediatric subspecialties if you want to. And so like it's a diverse field. You can choose from many options within the pediatrics. And this is a rewarding field. Like children, most of them has like short-term illnesses. 80% are infective illnesses in children. Another illnesses outcome is very good. Their body is growing and metabolism is fast. So when you see a patient and patients, then they get better very quickly. This is one of the reasons that this pediatrics is very rewarding. And research-wise, a lot of areas in pediatrics are still being researched, and in the UK there are a lot of opportunities to do research, to pursue PhD, and even postdoctoral scholarships are available. Fulbright scholarship like paid jobs are available, and you can do fully funded PhDs by doing research in pediatrics as well. And then constraint-wise, people say this is very busy, but it depends like which subspecialty in pediatrics you choose. General pediatrics is not busy. There are some subspecialties which can be busy, and busy is in a sense when you go at work, you stay busy at work. But if you're not that much busy in the work, you get bored as well. So this is like, and type of personality is dependent on that as well. Like if you like being busy at work, then it is for you. This is one of my reasons why I joined pediatrics. So I just put it on for the people. They can have a look like how rewarding pediatrics is. This 2-year-old child came unconscious to our emergency department after poisoning, and after 2 days she was running around. So this type of pictures you see in pediatrics only. Subspecialties wise, I just put a list of this, and again this list is not exhaustive. These are the subspecialties of pediatrics. You can do a lot in pediatrics if you want to. Cardiology, neurology, nephrology, rheumatology, gastroenterology, respiratory, allergy and immunology, hematology, diabetes and endocrine, emergency medicine, neurodisability, neurology, child and adolescent psychiatry and adolescent pediatrics and intensive care as well, neonatology. And neonatology is getting into further subspecialties like super specialties these days as well, gene therapy, bone marrow transplants. These are the like subspecialties. If you want to do further in, you can choose one of them and choose your career as. Then shape of the training. This is the shape of training is like you have 7 years of training. It used to be 8 years earlier, but now it is 7 years. You join at ST1. If you are a new graduate and after your foundation years, you join at ST1, and then you go along to ST7. And for the people who has prior experience of doing pediatrics, they can do from ST2, ST3, they can join at ST4 as well. And the trainees who are working in the European Economic Zone are the people who have already done like up to ST4. They can join at ST5 as well directly. So at the bottom of this slide, they've shown like what entry points you can enter into pediatric training. You can join at ST1, you can join at ST2, ST3, ST4, and ST5 as well. So the requirements are different at each level. So most of the people who join, they join at ST1, and then some people they join at ST3 and ST4. These are the more common pathways. So in the training, first 2 years, ST1 and ST2, you work as a core trainee like an SHO. And for ST3, you work for 6 months as SHO and for 6 months as a registrar in a district general hospital. And from ST4 onwards, you work as a registrar. Going into subspecialties, at the end of ST4, you apply for subspecialty training. It's also called grid training, and grid training has separate interview. Otherwise, pediatric training is a run-through program. If you don't apply for subspecialty, for being a general pediatrician or being a special interest in pediatrics, you don't apply for separately after you join ST1. So and then for going into grid means you're becoming a tertiary pediatric consultant, level 3 pediatric consultant. You will be working as a super specialist person in a tertiary care level hospital. So this is like an overview of the pediatric training, and you just join, do this. And then exams wise, there's only one exam you do at before your ST3 finishes. There's a MRCPCH exam. It has 2 written papers and 1 clinical. And then after that, you just go along, and then there's mention of START here. START is an assessment of your training, which says how you are doing, or are you able to be a consultant at the end of your training. It happens like as ST6 or ST7 before you complete your training. And you should have at least 6 months before you finish your training for doing the START. And then first, and they just identify the areas you need to work more on your to become a consultant. So to be a young consultant. So this is not an exam per se, but this is just an assessment. For if you fail it, even they just give you the feedback, and you just work on those feedback to become a consultant. Only exam and real exam is the MRCPCH for this. Then if you have like more questions, because this slide is very complex and I wanted to explain it more. If you have more and more questions, you can ask in the comments and I can explain it further. Then before I go as a life as a pediatrician as a consultant, I'll explain like how trainee's life is generally. This is for trainee's life. If depends like which hospital you are working in. Generally, across the UK, doesn't matter which specialty you are working in, they follow the European Working Time Directive, which means you only work for 48 hours in the rota. And if you're working nights or if you're working late shifts, you get 0 days in return off, like you get rest days after that. So in the pediatrics, it is the same. Doesn't matter how busy you are, how busy your shift is. Then after those night shifts and after the evening shifts, you get days off in return. And then overall, your rota averages up to 48 hours in a week. If you're working 1 week, 60 hours, you will be working less hours in the following week. So, and the generally rota is 1 in 6 for the pediatric trainees. And you are not very busy at the shift. So you get your CPD hours, you get your training time hours, like they are the mandatory hours in your rota. You get to improve your portfolio, and you get to learn for as well. And there's a monthly teaching days as well, and you have to go for that. The rota manager arranges for you to go there, and the consultants even hold the bleep for those days. And then life as a pediatrician, say for a consultant, there are few types of jobs for the consultants in the UK. You can do this. One is district general hospital. These are generally general pediatricians. This is the most common job as a pediatrician in the UK. Rota is generally 1 in 6, which means that every 6th day you are doing a call, like once in a week. You're doing a call, and depending on the hospital, in some hospitals you're doing like once in 2 weeks. Call means you're on call for 24 hours. Your call starts from not 24 hours, I think it's about 16 hours. Your call starts from around 4 p.m. in the afternoon, and it's until 8 o'clock or 9 o'clock, depending on the work start time at the hospital. So you don't come for the morning in the hospital, and you come only at the 4 o'clock and take handover and stay in the hospital for a few hours. Like I think most consultants, they stay until 9 or 10 o'clock, just to see if any serious patient is coming in, and leading the registrar and the other team decision making. Then you go home, and depending on the night shift, how night goes, but the next day morning you don't come to the hospital for the ward round. The ward round is done by the hot week consultant. Hot week consultant is the consultant who does ward round every day from Monday to Friday, and the hot week is like again like once in 6 weeks. You get like, it's just rotate like in the number of consultants in the department. So you do once in 6 weeks, you do hot week, and then you do your clinics, and that clinics is depending on which hospital and how the workload is. You do clinic once a week or twice a week. Generally, it is 2 clinics in a week, and then you do once a week your call, and then in 6 weeks you do the hot week. So the rota for consultants is very easy. And then for community pediatrician job is it's in the community. You do clinics in the community, and that's your only job. You see patients in community, and sometimes you do home visits for sick patients as well. So this is the 9 to 5 job like a general practitioner. This job is like a general pediatrician in the community, looking after the patients in the community. And no night on calls, no late shifts for this, and no weekends. And then consultant with special interest. These are the consultants in the district general hospitals who are doing the, like they have some special interest in, for example, somebody has a special interest in diabetes or allergy or asthma. They will do their own general pediatric clinic, and then they'll do an extra clinic for that specialty, like asthma clinic in the district general hospital, or they will look after diabetes in the catchment area, depending on. And then the tertiary level consultant job is you work only in the tertiary level hospitals, and you have your own subspecialty like rheumatology, and you are seeing only rheumatology patients, and you are on call only for rheumatology. And their rota works as the like hot week, and for that hot week you are on call 24/7 for that 1 week. And for on-call is not that busy as compared to the district general hospital, because you are only seeing your own subspecialty patients. You are not seeing any other patient. You are not seeing general pediatric patients at all. You're only seeing the subspecialty patients. So next slide, I'll say for the ratio, for those who wants to join pediatrics, the competition ratio is very low. Say application, but this is given on the MRCPch website. I'm not making it up. So this is from 2020. Applicants were 700, and out of those 645 were called for interview, and 461 got the position. So it means if 100 people are applying, 65 of them are getting it. So this is very high ratio. Like I'll say there's no competition at all. Like if you are doing good at an interview, if you fill your application with diligence, you will get it. This slide is just an overview. If you want to apply for pediatrics, what are the requirements for that? Generally, Applications come in November, December, and interviews are held in January to March. For ST1, you don't need any exams. For ST3 and ST4, you need exams. Pediatric experience for ST1, you don't need any. For ST3, 4, you need at least 24 months of pediatric experience. Then courses wise, ALS you only need for if you're applying for ST1. For ST3 and ST4, you don't need ALS. For APLS or PALS, this is Pediatric Advanced Life Support or Advanced Pediatric Life Support courses. You need them for ST3 and ST4 if you want to apply them. For Neonatal Life Support, you need it up if you're applying for ST3 and ST4. For ST1, you don't need it, but they arrange it for you to do it when you're joining before you join ST1. For safeguarding ST1 and ST2, if you have done it, that's very good. For ST3 and ST4, you need these courses. For competency, for ST1, they ask for the CREST form. And for ST3 and ST4, you need the level 1 completion form that's given on the website, Royal College of Pediatrics. So you can get that form. It's similar to CREST form, it's more specified to pediatrics. And then I'll go slightly, like there's no MSRA exam for the pediatrics, because for GP and for other specialties, they are taking the MSRA exams, but for the pediatrics, there is no exam like that. They only take application and the interview. An interview these days is pretty straightforward. It's on Teams, either one station of like 30 minutes or there are 2 stations for 15 minutes each, 15 to 20 minutes. And then they can ask questions from these areas, like they check your communication, they give you a short case, like dealing with a difficult patient, communicating with the patient. And for governors and leadership, either they can ask direct questions for governors or they can give you a scenario. And reflective practice is easy. They'll just ask you that you give us like an example of a case where things went very well or where things didn't go well as you expected, and you just describe a case and what was your role in that. And then after clinical thinking is they just ask you a question and you just answer like, how would you do in that particular scenario? That's everything from the presentation. I think we should move on towards the questions.
Dr. Raja, do you want me to begin with the questions then? Yeah? Right.
Yeah, you can start, yes.
Okay, so we do have a few questions. Somebody's asked, isn't there a ped infectious disease subspecialty separately, or is it included in the others?
Pediatric infectious diseases is a separate specialty. So you do, I think for pediatric infectious diseases, you can do masters after being a general pediatrician, and then you can, I'm not sure whether there's a separate grid in that, but the people who are working currently as infectious disease specialists, they have done their, I think, 2 to 4 years masters and fellowships separately from different universities to work as a pediatric infectious disease specialist. It is different from adults because the infection pattern in children is entirely different from the pediatrics, and the antibiotics we give to children is entirely different from adults as well. It's a different specialty.
Right. Thank you for that, Dr. Abrar. The next question is, if I have completed my PG training in home country, will it be possible to start with ST3 or ST4?
Answer is, I'll say simplified answer is yes, but there's a bit of complexity to it. What I would suggest, like if your pediatric training, if you have done your training in pediatrics in your home country and the training was at least 3 years, there are 2 ways for you. Either you do a PLAB and then come and apply for it. The other pathway for you is MTI, Medical Teaching Initiative. That would be if you have completed your degree in your home country and which was at least 3 years degree, MD or FCPS or other similar degrees. And those degrees, via MTI, you come as an SHO and then you work here for a couple of years and you apply for ST3, and everybody appreciate that. These are 2 pathways for you, but you can directly apply for ST3 or ST4. But applying for ST3 and ST4, you have to have the eligibility criteria. Eligibility criteria, I'll share that screen again. See, applying for ST3, you have to have most important thing is exam. MRCPCH, you should have 2 exams out of the 3 written parts, and for ST4, you have full MRCPCH. Doesn't matter you have how long you have worked in pediatrics, but you have to have the MRCPCH exams before you apply. This is the core requirement. Rest for APLS, ALS, these things and the safeguarding courses, you can do them before you join, but there are marking in the interview. You have to like you are marked on the application and interview whether you have these exams and these things. If you don't have these things, your marks will be less, and ultimately chances of being selected will be less. But simplified answer is yes, you can join directly, apply from out of the, if you're not working in the UK, you can apply it, and the chances of getting ST3 are more, but chances of getting ST4 are less, because they prefer people who have worked some time in the UK to be an ST4, because ST4 is a registrar and that is a senior post and has more responsibility. Yeah. So you can apply it and you can get it as well. People apply from Ireland and apply for the European countries who have worked in the system similar to the UK. They apply being outside the UK and they get it as well.
All right. I hope that's answered the question. The other question is, Dr. Abrar, what are the chances of getting ST after completing MRCPCH with no experience in the UK?
Yeah, so for getting the ST1, I'll say 100%. For ST3, no chances because you don't have a pediatric experience. So it depends like which level you're applying. For ST1, you'll definitely get it. For ST3, you have to have experience in pediatrics to apply for it. You cannot get your level 1 competency form signed without pediatric experience.
All right.
For ST1 is very easy to get. They'll get it easily.
Okay. One other question is, why is the competition ratio so huge for ST3 and ST4? And is it really tough for someone to get into specialty training?
So for ST1 is, the real seats are for ST1. Every year they recruit people for ST1. Every year they recruit people for 450 people across the country. What happens at ST3 and ST4 is some people, they don't continue their job as a pediatric trainee and seats are vacant. This is one reason. Some people go on maternity leave. Some people cannot pass their exams and do not keep up with the requirements. And then seats are vacant in certain areas. That is why the competition is high for ST3. Okay, this is not similar to the pediatrics, general medicine ST3 or the medicine subspecialty ST3s. Because in medicine, what happens is they do their core training for 2 years or 3 years, and then they apply for ST3. And ST3 starts from zero, and all the candidates are applying for ST3. In pediatrics, it is different. It is a run-through program. When you apply for ST1, you go up to ST8, ST7, sorry. So what happens is you apply as ST1 and you go along to ST7. If somebody is leaving at ST2 or ST3, what happens is those seats are lying vacant, and then they do a round 2 on those seats only which are vacant. They don't run a separate recruitment program for ST3 and ST4. That's why the competition at ST3 and ST4 is huge. And what was the second question with this?
The second part of the question was, is it really tough for someone to get into specialty training?
No, it's not difficult to get into specialty training. I don't know. The question is regarding ST3 or ST4 or ST1. For ST1, it is not difficult at all. I can do a separate presentation. How do you prepare for application and how do you prepare for interview? But for joining at ST1 is not difficult. For joining at ST3 and ST4, if you have pediatrics experience, again, it is not difficult for you. Difficulty comes if you say like I want to get in the, say in a specific hospital in the London, or I want to get in the Manchester or in specific areas. Then the difficulty arises. Like if you want, like I want my training in this area and in this university, then difficulty. If you are flexible in going to Northern Ireland or going to Scotland, you'll get it definitely. There's no difficulty.
Right. Shana has asked us, to get ST1 in Peds, what should I do during my foundation years to improve my portfolio?
I can share those things because if you go on the MRCPch website, I'll just share the other slide. Just give me a second. There's another presentation I have. So generally there are 6-7 points in the application. You just see on the MRCPch website, and they have given a like which areas, the questions they will ask for the pediatrics, and then this is the presentation. I'm just opening the other one, other presentation. I'll show you if you want to improve your CV and work, and then Applying to Pediatrics is these are the application questions they ask. Okay, so these are the areas you can work, and then they have specific numbers like on the application to mark your application. Transferable clinical skills, clinical experience, audit and QA projects, leadership and management experience, academic achievements. You can do any more in that, but you can do a second degree if you want to. I'll show you briefly what are the skills you can do, and teaching and education before you go on. So I'll go on the next slide. Yeah, so these are the basically 7 skills you can work on to make your application stronger. So I'll go one by one quickly on these transferable skills. I've given example like ALS and soft skills, flexibility. Are you good team player? You have good communication skills, and it says like which type of evidence you will show, and you'll get the 4 marks, or 4 out of 4 in this. Okay, and then areas of assessment like clinical experience and reflection. What you can do, and they have given this document is available on the MRCPch website. You download this document and work on the individual skills. And then audit and QA project, they have given like which type of audit and QA project you have done, and what is the proof they're looking for in your application. Again, for leadership, what you have done, even the leading an MDT or the leading a handover or leading a ward round, these type of skills comes as a leadership skills. Then academic achievements, and then teaching, informal teaching counts as well. Then suitability for pediatrics, like how suitable you are to pediatrics, you have to write yourself an essay, 600 words. Then application, you start early and then you read it through like what you have written. These are the tips. And then this is an example of an answer like you have given in your application. So these are the things generally you can work on. And then if you are committed to pediatrics, you prepare for the pediatric exams and give your exam as well, like any part of part 1, pass it before you apply it, and that will give you extra marks as well. They are counted as separate marks as well.
All right.
Okay.
Thank you for that, Dr. Abrar. I think there's a question that's very related to this. So somebody has asked some tips for leadership skills and teaching experience to get spot for ST1.
Okay. I think I did say in this one. For leadership skills, so leading roles you can have while you're working as ST1, if you're a medical student, if you have done anything like leading a cricket team, leading any club in the university, you can get a certificate or you can get a letter of recommendation saying that you were involved as a leader in that role. Okay, so in this as ST1 level, they know you are a new doctor and you won't have many medical experience. So what you can do is from your previous life, you can show that you are a leader. Okay, it doesn't matter. It doesn't have to be from the medical life. Okay? This is one thing. Other thing is you can lead like a medical emergency. If you led like a resuscitation scenario, if you have done like even for the resuscitation scenario, what you can write in the application that doesn't have to be a real scenario as well. You know, some hospitals, they run simulation programs, or you can ask your consultant that they do a simulation on a resuscitation, and you do lead that resuscitation in the simulation, and then you ask your consultant to give you a proof that you led that role and you led that well, and you can use that as a proof for that. And then handovers and organization skills, you can get a letter from your consultant that you are very good during your job and you are a good leader. That will work as well. But like, it doesn't necessarily give you the full 4 marks, but you can get some marks for that. And then for the teaching, so for the teaching, you can do informal teaching and the mentoring, like giving a presentation on some topic or giving a grand round in your hospital. If you have one, some hospital gives you the chance to do the teaching, like presenting a case from the ward round. You just saw a difficult patient or an interesting case, and you prepare a presentation, and the following week after the handover, you present or you doing the teaching time in your departmental teaching, you present it to the whole department and then get a feedback form signed from them, and you use that feedback form as an evidence that you did that teaching. And if you get the you have been involved in doing this teaching more and more, and these are the evidence you can get as a junior doctor, like as a foundation trainee. I think that answers the question. Yeah.
Yes, it does. Thank you so much, Dr. Abrar. Misha has said thank you for the session. Her question is, what if we have 2-year experience of emergency pediatrics and some courses included PLS, BLS, pediatric emergency course? Will it give some edge?
For pediatrics, doing the courses, say for the application marking point of view, it would give your, you know, that it says the commitment to the specialty. In that part, it would give you the edge that you are committed to the specialty and you have done your courses for that. And for emergency pediatrics, join the emergency pediatrics, you can, I think you join from the ST1 pediatrics, and then you go for the emergency pediatrics later on as a grid trainee or spin trainee afterwards. Or from some adult trainees, like from adult emergency medicine, they come to pediatrics as well. So later on when they have liked it. I think that this was the question, how do you get into emergency medicine and how the courses help in the application.
Right. She's also asked, what is the demand for emergency pediatrics in the UK?
I don't have specific numbers for it, but I can say like the demand is good. From my own experience, I can tell like we get like a lot of messages that the shortage of doctors is there in emergency pediatrics everywhere. And the emergency pediatric doctors are, as a consultant, more and more district hospitals are looking for them with busy emergencies. So demand is very good. So like you won't be unemployed in the UK with pediatric emergency medicine. Rest assured.
Right, okay. Somebody has asked, if someone isn't getting PLAB 1 seat, is it advisable to appear for MRCPCH?
If you are committed to pediatrics, I'll say yes. If you're not getting the PLAB 1 seat and you don't want to waste your time, you can do MRCPCH meanwhile. Yes, I'll advise yes. If like despite the, like if you have enough money and enough time to spend on pediatrics, I'll say yes, definitely do it.
And I was thinking about the question about how many parts of exams are there, because you mentioned there are 3 parts. Is that right? 2 MCQs and 1 clinical.
Yeah. So the parts for the clinical is sorry, for the MRCPCH there are total 3 papers. 3 papers means part 1 is divided into A and B. So the exam happens on the same day. In the morning time, 1 paper, and that is 1A, and in the evening you give part B. So they are called like as FOP and TS these days, Foundation of Practice and Theory and Science, but they are considered as a separate exams these days. And then part 2 is there. This is called AKP these days, Advanced Knowledge in Pediatrics. So sorry, Applying Knowledge in Pediatrics. So Applying Knowledge in Pediatrics is, it used to be called as part 2, and these are 2 papers in one day, and this is 1 exam. And then clinical exam is 1 day exam, 1 clinical exam. So totally, if you want to say like 3 written exams and then 1 clinical exam. So yeah.
And I think somebody has asked that can you, I don't know if it's relevant to this presentation, but he said, can you name 3 top common medication which you prescribe in pediatrics?
3 top common medicines which you prescribe in pediatrics. One is paracetamol. That's the most common we prescribe. Second is salbutamol. Inhalers we prescribe most commonly these days in the winter. And the third one is either amoxicillin or phenoxymethyl penicillin. These are the 3 common medicines we prescribe.
I think there was one more question about that, about do you have to pass the exam in the first 3 years? So if you don't pass these exams and you're in the run-through scheme, then will they give you extra time, or you just drop out, or what happens then?
So you have to pass the exam in next, yeah, that is correct. You have to pass the exam by the end of ST3. And if you don't pass it, they give you extra time. First, they give you 6 months, and they give you, it was on this slide. I'll share that slide again. Yeah. So what happens is, if you don't, yeah. So by end of ST, like these time, because of the COVID time, they have changed it. It is at end of the ST4 now, but it used to be at the end of ST3. By end of ST2, you have to pass your theory exams, and by end of the ST3, you pass your clinical exam as well. If you don't pass it, they give you the chances to like take extra time or go out of the program for a year. And then when you have the exam, your seat is still there. Okay, so it doesn't matter. Like say if you haven't passed your exam, and then you go out of program and pass your exam, come back after a year, you don't have to reappear in the interview. You just get your seat back, the same seat you left just for the time you were passing your exam. So I'll give you an example of my own. For passing the exam, as a trainee, you get a lot of support. For the clinical exam, I failed it 3 times. And then, like after 3 times, my educational supervisor said, "You're not passing this exam, and there has to be something we need to work on." She referred me to a psychologist. I went to that psychologist, and psychologist did some scenarios, communication scenarios with me, and he identified the areas which I need to work on. And then he told me some strategies to work on and prepare differently as compared to I was preparing before. So, and then next time I passed. So you have a lot of support. Like if you are a trainee, there's no question of failing the exam. If you fail it, your supervisor will guide you how to pass it next time. So if you're working in the UK and you are a trainee and forget about the passing exam, you will pass it.
Right. Dr. Abrar, there are a few more questions for you. So there's a question. I have an experience of 9 months in PEDS post internship in my country, but as a medical resident officer, does it help?
Yes, it will help. It will help in many ways. It will help you, like the pediatrics is same worldwide, like in terms of assessing children, in terms of knowing the main illnesses in the children. and the confidence you would have dealing with children will be there. So if you come here as a, say, foundation trainee or SHO to start with, you will have prior experience and getting your test form signed for the pediatrics, and like so you can and passing your exam. So you will have a lot of edge as compared to those people who doesn't have any experience in the pediatrics. So it definitely helps in getting the pediatric training. Yes, it will help in many ways.
Okay, thank you for that. There's another question. It says that, sir, can you please advise few study materials for FOP, FOP and TAS? I just don't know how to pronounce that. Sorry for that.
Okay.
Like there is a lot of material on net and it's quite confusing. Is it advisable to sit for FOP and TAS together or separately?
I would say advisable from my side. If you can study well for both together, you should sit together for both, and because there are a lot of overlapping in the preparation. For the preparatory material wise, some people say there are BMG on examination, and some people say past medicine question pools. Question pools like online question pool subscription. This is the most common, most useful and most common question pool people use. So then people ask which one to use first, like either BMJ one or the past medicine one. I'll say it's the same debate, either Samsung or iPhone. So you can choose one and then study well. So if you have taken one pool and you have to do it like 3-4 times before you appear in the exam, like the whole question bank, there are around 3,000 questions in the pool, and you have to do like 3 times before you appear it. And if you've done 3 times before you appear it, you'll definitely pass. And if you've done like 50% only once, and you barely know the theme questions, you will pass.
Thank you for that, Dr. Abrar. There's another question. I have done MCPS Pediatrics from Pakistan and MRCPCH, the first part. Clinical exam is still awaited. How can I plan to apply for UK without the clinical exam?
I will say preparation for OET and PLAB, then come to UK. This is the easiest way for this person, because MCPS, with MCPS you cannot come on the MTI. MTI is only for those training programs which has at least 3 years of training, and MCPS has only 2 years of training in it. So that is the reason this person cannot come on MTI. The other thing is, if he want to do MRCPCH sitting in Pakistan, that's again a difficult thing to do. I would say the easier way is to do the PLAB.
All right, thank you for that. There's another question. Is it mandatory to do PhD or any master's course to be consultant in any subspecialty, for example, pediatric hematology?
So this is a tricky question. For doing the grid training, this is not a necessity. Okay, you don't have to do a master's or PhD for doing a grid training. But for pediatric hematology specifically, and say pediatric cardiology, pediatric dermatology, these are the subspecialties which are quite competitive. Okay, so in those, like, you have to excel very well, and the people generally who does apply for them, they have done the PhDs. So if you appear in the interview and you don't have a PhD, everybody else would have PhD. This is not a requirement, but the people who apply for it, they have done these things before they apply, so it makes the competition up. So that makes it like difficult for one who doesn't have done. If you're lucky enough one time, then you can get it without doing it. But for other specialities which are less competitive, you don't have to.
Okay. I hope that's answered the question. Dr. Raja has put a feedback form in the comments, so if you guys can fill that as well. Let's move to the other question. The question says, is it possible to pass MRCP CH clinical exam from outside of UK?
It is possible, yes. Many people do living in the Middle East, and it is possible. It's only the difficulty comes only when you don't know the UK system, especially for the management and how do you deal with the patients. It is similar for any other exams, like for MRCP medicine, for MRC psych, and same for MRCPCH as well. If you are living outside the UK, and you can pass it, but you have to have the preparatory preparation according to the UK practice. You can pass. Many people do it from outside UK. They appear from Middle East, and they have done it.
Okay. Thank you so much for that, Dr. Abrar. I think, Dr. Raja, we're up to date with the questions. Is there anything else that that I've missed? Any questions that I have missed that you sort of?
No, I think you have covered them well. I just wanted to tell people that pediatrics is one of those specialties where when people ask us in terms of competition ratio, which specialties is easier to get in? My answer is always, you go for the specialties you really feel comfortable in. But then still, if you want us to compare the competition ratios, pediatrics is one of those that if you are really keen to become to go on peds, then that is one of the specialties if we call easier to get in. I won't, when I use this word, you have to use it very carefully, because that doesn't mean that you will get it automatically, but it means you have to still work it. But in comparison to, for example, core surgical training, all those sort of things, it's much easier. So like general practice is also easier, pediatrics is easier, psychiatry is not that difficult. Even IMT, the internal medical training, that is also not that difficult. But I like to thank Dr. Abrar. But Dr. Abrar, do you want to add anything else especially for people who, I think you did a very good presentation explaining that why you chose pediatrics yourself. But there is a perception out there that it is only for females, and it's not a male dominated specialty. Did you find any difference or any particular thing that you like to say on that point?
No, it's not. It's not a specialty for female. It's the specialties is for everybody, and there's no gender dominance in pediatrics. I just want to add one thing in like some people would they come to the UK for a few years. They say like they'll come to the UK, they'll do the specialization, get CCT, and then they'll go back to their home country. And because they want to do private practice back home and earn a lot of money. And those people, they won't come for surgery because they'll say they won't get it. Pediatrics is one of those subspecialties that you get a lot of private practice back in India and Pakistan especially. Pediatricians in Pakistan, I know they earn more than surgeons in their private practice. So this is one of those specialities. They can do specialization here and then go back and then earn in millions. This is one of those specialty. And regarding the again, like who this specialty is for, I would say it is for those who like to work with children and who like pediatrics in general. So this specialty is for them. Generally, if you don't like pediatrics and you just want to try it, I would say do a like trial week or a month, or say a 3 months job or 6 months job, and see how this is as an F2 or as an SHO, or if you don't, or do even observership and see how pediatrics is for you. This is my advice for those people who are just looking like I might do or I might not do it, or this specialty is not for me. People get afraid from the children because they are always crying and they don't get settled and they don't become your friends. So when you work in pediatrics, you know how this is. Like the parents are there with the children all the time. You don't have to babysit children as a pediatrician. Okay? This is one thing, and that if they're not settling it, parents will settle it, and we as a senior pediatrician will tell you the ways how to be friends with children and how to make them settled. So there are a lot of things you can do to make them like smile and work along. So don't worry about this thing, and just do a trial week in pediatrics, and you will feel the difference.
Thank you for that. There are a few more questions that I have collected, and I just wanted to cover them. Someone has asked for ST1, which region is the best in terms of training, if you can share your experience?
Which region is the best? The region wise, it depends like which type of subspecialties you want to do later on or spin training. Some regions has like some specialties more. I'm working in Manchester, and I say Manchester is very good. London is good, but living in London is expensive. Area with Cardiff and in the Wales is very good as well, and the hospitals are like scattered. Tertiary care hospitals are scattered across the UK. They are not centered in the center. So Liverpool Elderhay Hospital is very good, and Queen Victoria Hospital in the I think it is in Birmingham or in Scotland somewhere. They're very good. It depends like what do you want out of pediatrics. If you want to a general pediatrician, anywhere in the UK is good for you. And if you have some specific interest, like you want to get it in Manchester or you want to get it in London in some specific area, then you have to work more on your CV, and your application. All the areas are good for ST1.
Thank you for that, Dr. Abrar. There's another comment that says, thank you for the wonderful session. I have recently passed PLAB 2 and I am planning to pursue my career in pediatrics. How can I enter into pediatric training? Is there any specific requirement for that?
Yeah, I was sharing those requirements. Yeah. For ST1, you
I think it's similar for every training. You have to have this CREST form.
You have to get the CREST form. This is the most like core thing. You have to get it, and then you have to get the. There's one more thing with the CREST. You get CREST, and then you apply for it, and then you do the. Sorry, you need ALS. Just see the MRCPCH website, and they update it quite frequently. What do you need for it? CREST form is the most important thing to get, and then the rest, if you can do, is your exams for the MRCPCH. If you have done them, they are desirable. For ST1, there are not many requirements other than the CREST form. They're similar to other specialty as well. And then how do you rank your application better? I just if you I think recording will be available, and you can go back to that question earlier we answered.
Yeah, I think I would like to say, when you're applying for training, the requirements initially are similar. You know, the CREST form you'll sign it's not just for PEDS. It will be applicable for all training. You can use that to apply for GP, CST, psychiatry, whichever one you're applying, and you can apply for multiple training pathways at the same time as well. You don't need to stick to one. But I think it's good to sort of explore what is required for that particular specialty when you go for the interview stages. Sanaa, sorry, you were going to say something.
Yes, I was just moving towards the next question. The question is, I am FCPS pediatric trainee in Pakistan. How can I come to UK via MTI pathway?
So MTI pathway, you have to complete your FCPS. MTI is for those who have completed their degree, which is at least 3 years. And then you apply for the MTI through different universities, the Birmingham University, or then different in Manchester Foundation, like Manchester University Foundation Trust. They take trainees on MTI directly as well. And just search on the NHS jobs and the different universities on MRCPCH website as well. After completion of the requirement is after completion of your FCPS or MD in Pakistan, you do OET or IELTS, and then you apply for the MTI. And then the application and the interview, they score you on application and interview.
Okay. Thank you for that, Dr. Abrar. The next question is, what are the best hospitals for specialty neonatology training, in your opinion?
Best hospitals for the neonatology, there are some centers, I don't know for the neonatology training, the best ones which I know is the Manchester St. Mary's. But for the neonatal grid training, they don't let you do the whole training in one hospital. If you do go on to our RCPCH website, they have given the neonatal jobs as a grid trainee. if you get the jobs in St. Mary's, you do 18 months in the St. Mary's and you do 18 months in the Liverpool Women University Hospital. So the training is split. They don't make you do the whole job in one hospital as a trainee. So you don't have like if you do one job in one hospital, you don't have exposure from other hospitals and other population. So that they do make you go to other hospitals so that you have exposure to multiple hospitals and different type of colleagues and different type of environments to become a consultant. So to work in say the good big centers, which I know are the Manchester St. Mary's and then Liverpool Women Hospital, and then there are some centers in London as well. In Cardiff as well, it's a very good center.
Okay, the next question is from Abdullah. He's asking, can you please guide me the material used for MRCPCH Part 1, plus where to get complete guidance for the exam?
So complete guidance for the exam, if you by guidance, I don't know what you mean. I think if you want like what exam themes and what type of exam questions come in the exam, there are like you won't get the exact like questions from the previous exams. What you can get is the curriculum, like what are the topics you can prepare, and what are the exam themes, like which type of questions come in the exams. That's the only thing you can get. And then you can get practice questions. Like for example, I will say like a child comes in runny nose, cough, and increased work of breathing, and the age is only 3 months, and there's only mild pyrexia, and on examination there are few crepitations and wheeze on the chest. What is your diagnosis? This is bronchiolitis. Okay? And if I say you need to prepare bronchiolitis, so these are different way of saying it. Like this is the guidance. Okay, some people give you examples by questions, and some people just say like prepare bronchiolitis. They'll ask questions from bronchiolitis, and the bronchiolitis is a very like vast topic. You can prepare from like up to intubation and PICU management of bronchiolitis. So in short, the study materials for the part 1 is, as I said earlier, your 95% preparation is from the question pool. You get either on examination or past medicine, one of those, and prepare them well. Go through those 3,000 questions 3-4 times. This is the key, and you go through them easily. On the first time, you tag the questions. On the second time, you only do the tag questions, and then third time, you just do the like only those topics and areas where you were lagging in the on your last revision. So when you revise every time, you do less and less questions. Only those areas where you don't know the answers are where you need more focusing on. This is the way to prepare it. And if you have done well on your question pools, you will pass it easily.
Thank you for that. Hannah has actually asked us, what can IMGs do to make their clinical chances of getting selected in pediatrics better? I am still to give PLAB 1, so I have plenty of time, maybe 1 year or so to apply to after FY2. So what can I do in the meanwhile to make my chances better? So I think it's something that you've already answered, but do you want to add something more, considering that she's still in very early stages?
This is if you go on the application form on the ORIEL, or if you see this document on the MRCPCH website, I'll show you how do you get this document. This document is available, sorry, here. This one. If you search on the RCPCH website and search this ST1 application form scoring framework, this document on the number 3, scoring framework, application form scoring framework. So this scoring framework is this form. It tells you like which areas you need to work on. So it has your, like if you have done your exams, like any extra degree, it has marks for them. If you have done MRCPCH exams, it has marks for them. And then for each area out of these 7 areas, you have marks for them. So you can work on these areas. That is one thing. Another thing is get this book and just start reading it, like as your bedtime reading or when you are free. So just like one page each day, because you have plenty of time, you get the idea like what type of questions they ask and what type of answers you should give. Okay, these are the like this is the interview preparation and that was the application preparation. This is what you can do at this stage.
Right. Dr. Abrar, people are asking if they can have access to your slides. Would it be possible for us to make them available?
Yeah, I will share. I'll share with Dr. Adnan, and he can share on the on his page.
Right. So I think we have we've covered all the questions in the comment box. I would still ask people to keep on posting their questions so that we could ask Dr. Abrar and also fill the feedback form. Dr. Raja, do you have any other questions in the meantime?
No, I think I just like thank Dr. Abrar for taking time to give us his time and all the information he's given us. I think it's very useful, and we hope that it will encourage people to apply for PEDS, and especially the ones who are already interested in PEDS. You know, it will be one of the specialties they can pursue in UK. And as Dr. Abrar was saying, it's one of those where you can get specialization from UK and then move abroad. As he was saying, there are if you are a British trained pediatrician, you have good chances to work in other English-speaking countries, and also working in Dubai and Middle East countries. Your scope is well as well. So it's a good option to take if you are one of those doctors who want to come here and get a qualification and move out to find yourself another country.
I'll add to this. If you have CCT in pediatrics, you can go back work in the Middle East, Qatar, Dubai. Even some people go back to Saudi Arabia. And English-speaking countries wise, you can go to Australia and New Zealand without any extra exam. They take you as a specialist and they give you a consultant job. For Canada, I think you have to give their fellowship. You have to pass a fellowship exam, and you can work in Canada after this as well. So if you are planning to do something like that, I've seen people doing this. You can do this as well.
I think just one of the last questions, it's come from Arif. Arif is saying, I'm working in neonates in Bristol. I have not worked in PEDS in UK. I've applied for ST4 training. Is it possible to get into ST4 training without PEDS experience in UK?
I'll say no, because the eligibility criteria is you have to have 24 months of pediatrics experience and level 1 competency signed for pediatrics if you want to apply for ST3 in pediatrics. So you have to have pediatric experience if you want to apply for ST3 and ST4. For ST1, you don't have to have prior experience. Okay. Any other questions?
No, I think we've covered all the questions. Yeah.
Okay, then. No, thank you. Thank you very much for both of you for helping us run this presentation, and thank you everybody who joined and asked the questions.
Okay. Thank you.
I will